I'm Jeremy Fernandez. Welcome to The Vaccine, a new show filled with what you need to know as we enter a new phase of this pandemic. It's been a year since the scale of this crisis was just starting to sink in. That's when we brought you the program The Virus, filled with your questions and answers from the experts about how to understand and help manage everything from lockdowns to face masks, physical distancing and mental health. Now, as we approach the rollout of vaccines across Australia, there are more questions to be answered. How effective will they be? Are they safe for everyone? How do we deal with misinformation and vaccine resistance? We'll keep you in touch with the latest scientific evidence and public health measures every week so you can stay up to date. Eliza Harvey begins our coverage.
As the COVID-19 pandemic swept across the world, it quickly became the top priority of governments and institutions to fight the deadly virus. The key to winning this war, a vaccine. Scientists toiled away, driven by the need to stop the rising death rate, and for pharmaceutical companies, the lucrative contracts that would flow if they developed theirs first. Testing regulations were streamlined and public-private partnerships brokered to speed up the process. Then, in November, a breakthrough. The Pfizer vaccine was quickly approved by UK regulators due to spiralling infection rates there. The elderly were the first to get the jab in December, and by the beginning of the new year, the vaccination rollout was in full swing.
You're coming in for a pint of milk, right, and you're getting your jab done at the same time.
Across the Atlantic, the country most affected by the virus was struggling to inoculate its citizens in the face of a growing death count. But with a new US administration came an ambitious new program, 100 million jabs in President Biden's first 100 days in office.
My number one priority is getting vaccine in people's arms.
In Australia, our successful containment strategies gave the health regulator, the TGA, more time to assess the viability of candidates. But with rolling lockdowns exacting a huge economic toll, the race to find a solution here was just as fierce. The main candidate was the University of Queensland CSL vaccine. But the Phase 1 human trials exposed a flaw. Trial participants returned false positive HIV results.
Certainly a tough day for the team to get this news.
Especially seeing the very positive data come out of the trial.
The project was abandoned, leaving Australian hopes in the hands of two international contenders. The Pfizer vaccine has now been approved for people aged 16 and over. It will roll out to priority groups as there's only limited international supply. The second hurdle is distribution. The vaccine vials must be kept at -70 degrees. And with a country as large and as hot as Australia, it poses a difficult logistical problem. The rest of us will get the one developed by AstraZeneca. In the largest trial to date, that vaccine was 90% effective in volunteers who were given a low dose first, followed by a high dose. In those given 2 high doses, effectiveness was 62%. Overall, it's considered about 70% effective. There are many benefits associated with this vaccine. It can be manufactured at the CSL facilities in Melbourne and only has to be kept at standard refrigeration temperature.
The choice is not whether one is better than the other, it's which one is available to give the maximum rollout of vaccine to save lives and to protect lives this year. And the answer to that is the one we can make here.
The big question is whether Australia can achieve herd immunity. That remains unclear, with a suggestion that children might need to be vaccinated to achieve it. No kids have been included in COVID trials. The first step is getting a dose for all Australian adults. That's something Prime Minister Scott Morrison is confident of doing.
This will be one of the largest logistics exercises ever seen in Australia. We'll be vaccinating more than 25 million people, having secured over 140 million doses.
The vaccination rollout should begin in late February and be complete by October 2021. Australia is spending $6.3 billion on its COVID response. The vaccine will be administered through hospitals, GPs, pharmacies, respiratory clinics and Aboriginal health services, alongside a specialist workforce. Some questions still remain about the virus. Will the vaccine stop transmission? How long will it last? And will it be effective in the face of new mutant strains of the virus emerging around the world?
And we learnt this week that those virus mutations are changing vaccine effectiveness. The World Health Organization has acknowledged the AstraZeneca shot was only offering minimal protection against mild and moderate cases of the so-called South African variant in young people. Its interim recommendation, though, says the vaccine is nevertheless 63% effective overall and should continue to be used. Oxford scientists say it still prevents people from becoming seriously ill and needing hospital treatment, and they're already working on updated vaccines and boosters to guard against new strains. And in a sign of just how virulent the mutations are and how much needed the vaccine rollout is for Australia, Victoria's been plunged into another statewide lockdown. The UK strain has been identified as the cause of the Holiday Inn outbreak, where confirmed cases continue to grow. Victorians will only be able to leave home for essential supplies, exercise, essential work, or to give or receive care. Face masks will need to be worn indoors and outdoors, and no visitors will be allowed in homes. Sarah Palmer is the Deputy Director of the Centre for Virus Research at the University of Sydney. She says the variants are a real concern.
It is absolutely the natural evolution of viruses to mutate and change. And as this virus travels through hundreds of millions of immune systems, as it infects hundreds of millions of people across the globe, it will select those mutations that will allow it to become more infectious and also to evade our immune responses.
So what do these variants mean for vaccine efficacy? We've seen not just the British and South African variants, but the one that's popped up in Brazil as well. What does it mean for the vaccines that we currently have on order?
Sure. So for all of the vaccines, they lose efficacy against the South African strain. So it is a very serious strain. And the UK strain, it contains a mutation that makes it more infectious, but the vaccines appear to be more effective against this strain. But the South African strain, all of the vaccines are losing efficacy against this strain. And it's due to the fact that this strain has additional mutations that allows it to evade the immune system. So it contains the mutation that the UK strain has that allows it to become more infectious, but it also has additional mutations that allows it to evade the immune system. And while it does that and evade the vaccine efficacy and reduce the efficacy of the vaccines, so these additional mutations allow the South African strain to really become more potent and less responsive to these vaccine treatments.
Put this in context for us. Can anyone draw the conclusion by that analysis, by those decisions in Germany and South Africa, that the AstraZeneca vaccine is a poorer form of the vaccine?
Well, what it really means is that we don't know as we roll out these vaccines how effective they will be in the elderly. The AstraZeneca vaccine has been found to be less effective in the elderly. And to be honest, we don't know whether all the other vaccines will be as effective in people who are of an older age or elderly. So it does mean that for this vaccine, the AstraZeneca vaccine, that it has additional problems and it is not as potent and good as a vaccine as, say, the Pfizer or the Moderna vaccine.
Is that likely to stand in the way of the Therapeutic Goods Administration approving the vaccine for use in Australia?
I'm sure they'll take a good look at the data and decide whether these are issues that are important for Australia. But as we move forward, it's really important that we all become vaccinated, because in order to stop the virus from mutating, we must stop it from replicating. And the only way we can stop it from replicating is for us to all become vaccinated.
How agile can these vaccines be? How easily can they be tweaked from the existing vaccine versus creating a whole new vaccine altogether?
Yes, that's a really great question. And all of the companies now are looking at how they can change their vaccine and develop a booster that will make their vaccine more effective against these new variants. So in some of these vaccines and these new boosters could be available as soon as 3 to 6 months.
And so when you talk about boosters, does it mean that for whatever vaccine you get, it will need to be boosted, topped up over a period of time, 6 months, 1 year, 3 years?
It could mean that. What it really means is that we have to be very vigilant in watching how this virus mutates and changes as it rampages across the globe. And so by really determining how it's changing, we can change the vaccines and make them more effective. If you think about other vaccinations, say, for example, hepatitis B, it does require boosters. And so the vaccine for COVID could be just the same in that we have to have boosters possibly every year if new strains arise. But what's most important is if we could really stop the replication of the virus by most people being vaccinated. If we can stop it from replicating, then we can stop it from mutating.
The primary vaccines coming to Australia are the Pfizer and AstraZeneca ones. Should we be looking at a broader suite of vaccines in the medium term?
Well, the government could be looking at a broader suite of vaccines, and we just don't know that. But also, we should remain vigilant to see whether these vaccines will require a booster. And if they do, then we ask our society to please step up and take the booster as well.
What can you tell us at this stage about the effectiveness of the vaccine in passing on the virus? We know that they are effective in varying degrees to stopping people getting severe forms of the disease. What about the ability to pass on the disease to other people?
Yes, so we know the vaccines mitigate disease, but what we don't know, and we're still studying, is whether they actually stop new infection. So even as we get vaccinated, we still have to maintain our social distancing until 85% of the population is vaccinated. And this will lead to a better herd immunity across Australia. So absolutely, even though we're vaccinated, it doesn't mean that it's stopping the virus from being infectious.
Is 85% achievable?
It should be. And it's important that it is, because if we want to travel in the future, we would have to have everyone vaccinated, or 85% of the global community vaccinated. I think what this pandemic is showing us, Jeremy, is how interconnected we are as a global community. And if we really want to be able to travel again in the future, we have to ensure that the vaccines are rolled out globally, and that 85% of people who have access will take the vaccine.
Well, this week, a WHO team concluded their investigation into the origins of the virus in China. The team discovered new information, but said it doesn't dramatically change the picture of how the outbreak began. Regardless of the geopolitical blame game, China says it's committed to finding a solution.
China has been producing multiple vaccines and testing them on its military. The frontrunners are from two companies, Sinovac and Sinopharm. They work in the same way that the vaccines for rabies, hepatitis A and many others do. First, the virus is killed so it won't cause an infection, and then injected into recipients. The person's immune system responds and produces antibodies, which are then ready to fight off any future infections. Like the AstraZeneca vaccine, they only need to be kept in the fridge, a key advantage when it comes to storage and distribution. So far, Sinovac and Sinopharm have been approved for use in more than 20 countries, including Turkey, Brazil, the UAE and Indonesia. But what's unclear is how well they work. Recently, test results from Brazil show Sinovac was only 50.4% effective. This is barely above the World Health Organization's threshold for a viable vaccine.
With several vaccines now available, more and more people are receiving the potentially life-saving shots. Here's Casey Briggs with the numbers.
Most of the milestones we've talked about through this pandemic have been very unwelcome ones, but here is a positive one that we crossed at the start of this month. Since February 2nd, more doses of a coronavirus vaccine have been administered than the total number of infections found by humanity since this pandemic began. Millions of people now are getting a jab every single day. And that's among the around 70 countries that have begun vaccination rollout campaigns. Most of the faster movers have been among countries facing severe outbreaks, like the United Kingdom, like the United States. But the fastest out the gates has been Israel, a country that too is recording a serious wave at the moment. Things do look now to be improving, partly because of the country's third national lockdown. That would undoubtedly have an effect, but it does look like we're seeing the effect of vaccines as well in these numbers. Here's how we can tell. About a quarter of Israelis now have been fully vaccinated using the Pfizer vaccine. Another 15% have had their first dose. So within a month or so, they should be fully vaccinated as well. And Israel, like many countries, has been prioritising older people in its rollout. More than 80% of those aged over 70 have been fully vaccinated already. In the decade below, we're looking at 70% fully vaccinated. And as the curve is decreasing, we're also seeing changes in the makeup of the cases. Through October, November, December, Israelis over 60 made up about 15 or more % of the country's cases. That is now trending downwards. We're now seeing less than 10% of the cases in Israel among people over 60. That's a hopeful sign that we're not just seeing decreases in severe illness and disease from these vaccines, but also a reduced transmission rate. And hopefully, with fewer older people being infected, we'll also soon start to see some aggressive suppression of this curve, the number of people dying every day. That's Israel, the country with the most advanced rollout of a vaccine, but we're still seeing more than 10,000 people dying every day with COVID-19. The United States remains by far the biggest single contributor to this curve every single day. About 10.5 million Americans have been fully vaccinated from COVID-19 with one of the vaccines that they're using there. And Joe Biden today announced deals have been struck to get another 200 million doses. So they've got the supply on the way. The big question is, how quickly can they get those jabs into people's arms?
Our medical reporter Sophie Scott is with us now. Sophie, let's take a look at the situation here in Australia. How is the vaccinations program here going to look in the next few months?
Look, we're in a very good position. The Australian government sort of hedged their bets somewhat in terms of having a number of different vaccines that we can depend on. The first of those, and the only one that's actually been approved for use in Australia, is the Pfizer vaccine. We're expecting delivery of that in the next, even as early as next week, and it'll be rolled out fairly soon after that. They need to do what's called batch testing. So once the Pfizer vaccine arrives, they'll test different batches of it. Now, this vaccine is the one that has to be stored at below 70 degrees. So it won't be the one delivered in doctors' surgeries. It'll be delivered in things like hospitals, or specially trained workers will go into like aged care, go into disability centres, and they'll deliver the vaccine. So this is for our priority workforce. So like hotel quarantine, border force workers, the people who are really at the front line, you know, intensive care workers, emergency doctors, they'll get the Pfizer vaccine, and so will a second group of high priority individuals. But the majority of us will get the AstraZeneca vaccine, and there are going to be two ways to get that. There's going to be one lot of the AstraZeneca vaccine, which is going to be coming from overseas, and that's likely to be approved in early March. And then the second lot will be what we produce here in Australia. And the real advantage of that is that we have a continuous supply, because there have been issues with supply of the other vaccines that are made in other parts of the world, whereas by having a vaccine, and this is one of the things the government's really been talking a lot about, by having a vaccine that we can produce here for people here, it'll ensure that we have a constant supply. So that's really why the government's taken the tack that they have, having a number of different vaccines. So Pfizer, first cab off the rank, but for the priority people only. And the second one is AstraZeneca. And you won't have a choice. You really need to look at where you line up, in which group you're in, and it's very clear based on your risk and also really based on your age as well. Age is a huge factor. And it's going to be, the government will be rolling out campaigns, and you'll be told when it's your turn to get a vaccine. So you won't need to sort of wait and monitor and see what's going on. There'll be public health campaigns about which phase of the rollout we're in, and people will know it's their turn. So they're not leaving much to chance at all. They're going to make sure the goal is to get as many Australians vaccinated as possible. We know that that's the best chance of getting life back to some sort of normality. And that's why they've got these range of vaccines, but the first two, as I said, Pfizer and AstraZeneca.
Sophie, you've taken an inside look at the manufacturing of the vaccine, the AstraZeneca vaccine here in Australia. It's really an extraordinary operation, isn't it?
It is. So CSL basically really had to change everything that they were doing when they went into an agreement with the government to produce the AstraZeneca vaccine. So what happens is they get the, if you think of it like a recipe, CSL gets the main raw material and ingredients to make the vaccine from AstraZeneca in the UK. So the two main ingredients, the human cells and then the virus that's got the spike of the coronavirus embedded into it, they get that from AstraZeneca, and they grow those two ingredients up into big vats, and then it's then harvested to take the really great stuff out of it that makes the vaccine. It's then frozen and shipped over to another factory in Melbourne where they do the final part of it, which is putting it into the little vials. And we were able to get a really amazing insight into how they do this, just the sheer scope and the scale of making this material. And you know, they're hoping to produce 1 million doses in a week, which is a lot of vaccine. And so it's a massive undertaking. The workers there have been working literally night and day for months to get this to happen. And you know, it's a huge endeavour. It's a huge public health measure to be making such a vaccine, to vaccinate so many Australians. And like I said, the real advantage is having a local production line here will mean that Australia won't be subject to the supply problems that other countries have had. And now there are some issues to do with the efficacy of the AstraZeneca vaccine. Some countries have not given it to people aged over 65. South Africa has stopped giving it to people there because it wasn't as effective against the South African variant. But the WHO has come out in the last couple of days and said that they do believe it is safe, and certainly no issues to do with safety, but they believe it's effective for all age groups.
And if you'd like to find out when you'll get the vaccine, our Storylab team has put together a simple questionnaire which gives you a guide to where you sit on the priority list. Just search for ABC Storylab and follow the links. Since the start of the pandemic, we've been bombarded with information about the virus and now vaccines. Alongside that, there's been a rise in misinformation. Olivia Willis from ABC Science says it's crucial that people are properly informed about vaccinations because the whole nation's COVID defence depends on it.
It is a significant threat. Misinformation about COVID or vaccines, like any other misinformation, poses a real problem, in this instance a challenge for our public health. And I think it's quite a tricky thing to address, both in the media and in our public health kind of strategies, and also as individuals in how we have conversations with friends and family. And we don't have to look very far to see, I guess, the real world consequences of misinformation, particularly misinformation online. So we had the storming of the US Capitol in January. That showed us what can happen when people are misinformed through social media. And I guess in the context of COVID-19, the consequences are consequences for our health, both at an individual level, putting ourselves potentially at increased risk if we read misinformation and perhaps become a little bit concerned or hesitant about the vaccine, and also at a public health level, because the success of vaccines relies on widespread uptake. And so we've all kind of got a stake in the game when it comes to misinfo.
You would think there's ample evidence to show the effects of COVID-19 right around the world. So why do you think we are seeing misinformation spread so rapidly?
I think it's a complicated question. Vaccine misinformation, in a way, isn't really anything new. We've had a long kind of tradition of a small but very vocal minority of people in the community kind of espousing anti-vaccination views and in that spreading pseudoscientific information. And obviously within the pandemic, that's really been helped spread by social media and the ubiquity of social media. And I think, you know, places like Facebook and Twitter and other platforms have tried to counter a bit of that. There's now some warnings on misinformation which guides us to more credible sources. But I think, you know, they've still received quite a bit of criticism that regulation is not strong enough. So I think that's one of the problems, is how that kind of ecosystem works. I think probably the other thing in the context of COVID-19 is the environment in which the misinformation is spreading is important. And by that I mean the last year and a half has been marked by a lot of upheaval and uncertainty, and we're watching the science kind of unfold in real time. And so with that comes a lot of unknowns, and our understanding about the virus and the vaccines, that changes. Sometimes it feels like day to day. And so people are probably in a position where we're a little bit more vulnerable to seeing information that's not credible or trustworthy, because we're kind of overwhelmed with information all the time. And I think, you know, where mainstream science tends to be cautious cautious and we kind of proceed with a little bit of trepidation, as we should, because there's a lot we still don't know. People who spread misinformation, and misinformation generally tends to offer us a narrative that has assurances and certainty and is often quite emotional in its nature. And so people can tend to want to kind of lean into that information because it offers a simple answer when in fact it's more complicated.
As a science reporter, is misinformation the same as vaccine hesitancy? I mean, if someone is feeling a bit reticent about these vaccines coming out, does it mean that they're reading the wrong information, or is their suspicion perhaps valid in some ways because the science, as you say, isn't perfect?
Yeah, that's exactly right, and that's a really important distinction to make when we're talking about vaccine hesitancy. Generally speaking, Australians are broadly in support of immunisation. We have very strong rates of childhood immunisation. And when it comes to the COVID vaccines, we're seeing that proportion of people who are hesitant is a little bit bigger than what we normally see. But that doesn't necessarily mean they're all people who are actively against vaccination or ideologically opposed or anything like we normally think about when we think of anti-vaxxers, so to speak. Generally, it's normal that there's some hesitancy and that there's some questions. We'd see that with any kind of new vaccine. Because it's new, we're still learning things about it, so it makes sense that people have some questions. And I think we need to be careful not to kind of jump down people's throats or be too quick to jump to conclusions when people maybe express a bit of hesitancy or concern. It's about trying to understand where they're coming from and maybe interrogate what they've read or what's making them feel worried.
Do you have some advice on helping people assess when it might be useful to engage and when it's time to perhaps step back and let go for a moment?
Yeah, look, conversations about vaccines can be really emotive, and vaccine researchers and communication experts, they really recommend, rather than we all kind of have this temptation where we want to immediately correct information or, play a bit of this game of scientific ping pong of trying to throw facts at someone. And actually, that usually doesn't work, and in some cases can actually entrench those views and concerns a bit further. So the best way to do it is firstly assess whether it's worth engaging. Is this someone who's open to other viewpoints? And if they are, then potentially proceed with that. And then, try and get on their level a bit. What is it that's making them feel concerned? Try and make them feel heard and respected, even if you don't agree with them, just acknowledging where they're at. And maybe there's an opportunity, if they tell you what's worrying them, that you can kind of say, okay, well, I've read information, or the Department of Health says this, or my doctor says this. You can try and point them in the direction of some trustworthy info. And the other thing is we can also act as role models. If you intend to get vaccinated and you want to get vaccinated, it's important to share that with your friends and family, that you want to do that, why you want to do that, that you think it's a good thing to do in the community. All those things can help rather than kind of attacking people and patronising people, which doesn't get us very far.
And that is the show for this week. Join us every Friday at this time on the News Channel, as well as on demand on iView and the ABC News Channel on YouTube. From us, bye for now.